Welcome to The Explainer. So today we're going to do something, well, honestly, pretty incredibly powerful. We're taking over 140 of those massive, completely disjointed practice questions and distilling them down into really clear, actionable rules for mastering the pharmacy counter. Whether you're gearing up for your pharmacy technician certification board exam, or maybe you just want to understand the intense, rigorous safety standards that literally keep patients alive, you are absolutely in the right place. Because, we aren't just blindly memorizing facts today. Oh no, we are building a rock-solid, structural understanding of how a pharmacy actually works from the ground up. Okay, let's dive right into this. To conquer all this overwhelming material, we're breaking it down into 4 highly structured core pillars to make retention basically effortless. We've got pharmacy law and regulations, pharmacology and patient safety, mastering pharmacy calculations, and safe compounding practices.
Starting right off with pillar number 1, pharmacy law and regulations. So look, federal laws form the absolute backbone of our daily operations as techs. Every single pill that comes in or goes out of a pharmacy is heavily tracked, regulated, and monitored. Why? To prevent diversion and abuse. And a huge chunk of that tracking, it relies on proper documentation. To track controlled substances, the Drug Enforcement Administration, the DEA, uses very specific forms. And let me tell you, they love to test you on this. To lock these into your memory forever, I want you to just remember the DIR pattern. D is for destruction, that's DEA Form 41, which you use when you're sending expired drugs off to a reverse distributor. I is for inventory or theft, that's Form 106, which you grab when drugs go missing. And R is for reordering, that is Form 222, the official federal form you absolutely need to order Schedule II controlled substances. So DIR 41 106 222. Pretty simple, right?
Let's put you in a high-stakes, real-world scenario for a second. Imagine you're working the counter. A patient walks up, brings in a prescription for Percocet, which, if you remember, is a Schedule II controlled substance containing oxycodone. They ask you exactly how many refills they're legally allowed to get on this script. Take a beat and really think about it. What are you going to tell them? The answer is 0. Absolutely none. Federal law strictly prohibits refills on any Schedule II medications. A brand new original prescription from the doctor is required every single time. And that's because these drugs have such a remarkably high potential for abuse. Now, if we contrast that with Schedule III and IV drugs, think of certain anti-anxiety meds or sleep aids. For those ones, DEA regulations are a bit looser. They allow up to 5 refills within a 6-month period before the script completely expires. So the crucial point here is that understanding these legal categories helps you immediately identify the level of danger a drug poses. And speaking of danger, let's talk about recalls. When the FDA pulls a drug from the shelves, they do it in classes. Now, a Class 1 recall, that is the absolute most severe category. This means there is a very real, very terrifying possibility that exposure to this drug could cause serious injury or, worst-case scenario, death. It requires immediate, urgent action from the pharmacy. That's a huge contrast to a Class 2 recall, which usually just deals with temporary or medically reversible health issues. And this brilliantly illustrates how time dictates so much of what we do in the pharmacy. We can actually map out expiration dates chronologically, so you literally never have to guess on beyond use dates ever again. Think about how this maps out. At 14 days, those water-containing oral antibiotics you keep in the fridge, they expire. At 28 days, insulin stored at room temperature expires. Then we jump to the 6-month mark, where 2 huge things happen. Those Schedule III and IV prescriptions we just talked about become totally invalid, and non-aqueous compounded products officially hit their maximum beyond use date. All right, moving on to pillar number 2, pharmacology and patient safety. Because knowing the laws is really only half the battle. We also have to protect patients from the drugs themselves. Pharmacology dictates how we protect patients because, honestly, drug interactions can be absolutely deadly. So imagine a patient who takes Simvastatin for their cholesterol, and they just love having a fresh, tall glass of grapefruit juice every single morning. Seems like a healthy habit, right? Wrong. Actually, grapefruit juice blocks the CYP3A4 enzyme in the liver, and without that enzyme, the statin just builds and builds in the bloodstream up to toxic levels, causing this incredibly severe muscle breakdown called rhabdomyolysis. Or take the antibiotic tetracycline. If a patient washes that down with some dairy, the calcium in the milk literally binds to the drug in their stomach. It completely blocks it from being absorbed. Okay, let's test your safety radar again. A patient who's currently taking warfarin, which is a really powerful blood thinner, walks right up to your counter. They complain about a terrible headache and ask you for an over-the-counter pain reliever recommendation. Do you point them toward aspirin or acetaminophen?
You absolutely must steer them toward acetaminophen, without question. Warfarin is what we call a high-alert medication, meaning it has a really narrow therapeutic index. Basically, the difference between a totally safe dose and a deadly dose is razor thin. Now, aspirin affects platelet aggregation. It thins the blood. So if they pop an aspirin while they're already on warfarin, they are significantly increasing their risk of a fatal internal bleed. You've got to be extremely cautious. Another massive, and I mean massive, safety threat we face are LASA drugs. That stands for medications that look alike and sound alike. Take hydralazine, which is used to treat high blood pressure, and compare it to hydroxyzine, which is an antihistamine used for anxiety. Or how about prednisolone and prednisone? Just a simple misread on a label could cause a completely catastrophic dispensing error, and that is exactly why pharmacies use tallman lettering. They capitalize very specific parts of the drug name on the bottle just to visually highlight those tricky differences, basically forcing the technician to stop and double-check. Now, what's really interesting about this is how you can use some super basic word patterns to instantly decode hundreds of different medications. If a generic drug ends in pril, like lisinopril, well, it's an ACE inhibitor for blood pressure. And boom, you instantly know to watch out for its classic side effect, a persistent dry cough. If it ends in statin, it's a cholesterol reducer, which carries that risk of muscle pain we talked about. If it ends in prozol, like omeprazole, it's a proton pump inhibitor used to knock out stomach acid. Honestly, memorize these 3 simple suffixes, and you essentially unlock the ability to conquer pharmacology. Which brings us perfectly to pillar number 3, mastering pharmacy calculations. And hey, don't worry, we're going to demystify all this complex math. Look, I know math can cause a ton of anxiety for people, but we're going to break these terrifying calculations down into foolproof, repeatable steps. Let's look at a classic exam question. A doctor orders 1,000 milliliters of an IV fluid to be infused over 12 hours, with a drop factor of 15 drops per milliliter. So what's the flow rate? I know, it looks super intimidating, but it's really just simple multiplication and division. Step 1, multiply your total volume, so 1,000 milliliters, by the drop factor of 15. That gives you 15,000. Step 2, figure out the total minutes. 12 hours times 60 minutes, that's 720 minutes. Step 3, just divide that 15,000 by 720. The answer, right about 21 drops per minute. See, just follow the steps. All right, let's try one more calculation, and this one is absolutely vital for pediatric safety. A pediatrician orders an antibiotic at a dose of 10 milligrams per kilogram of body weight for a child who weighs 44 pounds. What is the total daily dose? Think about that crucial conversion factor you're going to need here. To solve this, you absolutely must remember the golden rule. There are 2.2 pounds in a kilogram. That is the magic number. So step 1, divide 44 pounds by 2.2, which gives you exactly 20 kilograms. Now that you've got the child's weight in kilograms, step 2 is a total breeze. Just multiply that 20 kilograms by the prescribed dose of 10 milligrams. And there you have it. The result is a safe, completely accurate daily dose of 200 milligrams. Remembering to divide those pounds by 2.2 is literally the absolute key to pediatric safety. Now let's move on to our final pillar, number 4, safe compounding practices. We're moving away from the math and stepping right into the highly controlled physical environment. Let's see how this builds, because in compounding medications, protecting the drug from any sort of contamination is your absolute top priority. Putting on personal protective equipment, or garbing as we call it, builds a literal wall of protection around the medication, and it's not a free-for-all. It is a strict sequential process governed by USP guidelines. You always dress from the dirtiest parts of your body to the cleanest, so you start from the ground up. Shoe covers first, then you cover your hair and any facial hair, then comes the face mask, followed by your gown. Finally, once you are actually inside the clean area, you put on the cleanest item last, your sterile, chemotherapy-rated gloves. Now, when it comes to non-sterile compounding, you really need to know your techniques. One of the most heavily tested concepts on the exam is trituration. So what is it? It's the continuous rubbing or grinding of a solid, dry substance inside a mortar with a pestle to reduce its particle size down into a really fine powder. But here's the trick. Do not get this mixed up with levigation. Levigation sounds kind of similar, but it actually involves adding a liquid to that powder to make a wet paste. Just remember, trituration is dry grinding, levigation uses liquid. Okay, let's step virtually into the sterile compounding room for a second. Imagine you're about to mix an IV bag for a patient inside a laminar flow hood. Obviously, before you start, you have to disinfect the workspace. So in what exact direction must you wipe those surfaces? Think carefully here, because doing this backward will literally push room contaminants directly into the sterile drug you're about to prepare. You got it? You must always clean from the cleanest area to the dirtiest area. Inside a hood, the HEPA filter all the way at the back is the cleanest part, and the front edge, where you're standing, is the dirtiest. So you always wipe from back to front and from top to bottom. And what exactly are you using to do this? Sterile 70% isopropyl alcohol. It is the absolute gold standard for maintaining that super strict USP 797 sterile environment. And why are we so incredibly obsessed with how we clean? Well, it all comes down to ISO air quality standards. In these clean rooms, the rule of thumb is the lower the ISO number, the cleaner the air. The buffer room, the area where you're standing, is maintained at an ISO class 7. But the inside of the laminar flow hood, that critical site where the needle actually punctures the IV bag, that must be a pristine, highly filtered ISO class 5 environment, the highest sterility possible. So we've covered the laws, the pharmacology, the math, and the compounding standards, but I really want to leave you with one final thought. Beyond just passing an exam, how will mastering these pillars help you catch a hidden prescription error and potentially save a life tomorrow? Because remember, this explainer isn't just about test prep. It's about becoming that final, vital safety net that every single patient relies on when they walk up to the pharmacy counter. Keep studying, keep asking the hard questions, and you are going to do fantastic.